EKTV Daybreak Nigeria with inclusive information, news without prejudice, well-articulated reportage, in-depth news analysis, newspaper highlights, business news, sports. Watch EKTV Daybreak Nigeria from 8 to 10 in the morning, Mondays, Tuesdays and Thursdays. EKTV Daybreak Nigeria.
All right, it's another beautiful Tuesday morning. Thanks for joining us on today's edition of our program, Daybreak Nigeria, your trusted platform for in-depth analysis on issues that matter. My name is Olayin Kailori, and I'm delighted to have you join us on the program today. We are honored to be joined by a medical sociologist, Professor Christopher Oluwadare, who will be sharing expert insights on the roles of medical sociologists in public health campaign. Professor Oluwadare, once again, congratulations on the delivery of the 93rd inaugural lecture of Ekiti State University. How does it feel to reach this academic milestone?
My brother, good morning. And my colleagues at home, my junior ones, my senior ones, my daddy and mommy, good morning also. It has all been by grace of God. For people who attended the inaugural lecture on the 24th, that is Tuesday, in my secondary school, they called me Taye Kekere. That means I was so small, I was smallish, but a little bit troublesome. But that troublesome boy in secondary school went to advanced level also in Oshobo Grammar School. He was troublesome also, but a little bit serious, but outside very troublesome. But I was able to make enough grade to make me to enter direct entry into University of Ibadan. And Yoruba people will say, "Mo wa yara mi brain," when I got to the university, that this destiny must speak. Out of the 5 terms in my advanced level education, I only attended classes for 3 out of the 5. My teachers drove me out of the class always. But yet, I was able to make enough grade to enter university to read sociology. When I got to University of Ibadan, I sat down. I thought within myself, I must not be troublesome again. I must be studious. I must be serious with my studies. And that is what made me to excel, even in my first degree, second degree, and the PhD at University of Ibadan. All glory to God. And that is why sometimes when I see myself, I only commit myself to God again. If you can make me to be like this, then there's nothing, there's no place that anybody can be that I cannot be great. And my students also, I usually tell them, even if they are troublesome, even if they think they cannot make it, I use my own story to encourage them that you can make it. You can have a rethink. You can be serious again. That's the story of City Oluwadare today, by the grace of God.
All right, what was the title of the lecture and why did you choose that title?
Sincerely speaking, the first draft of that paper was written in 2018. It's on my laptop. My wife can be a witness. My children can be a witness. It was last year, and I thought I must do this, or I will not do it until I retire. So I started to rework that paper. And I found out that when I started working since 1993-94, everything I've been writing about medicine, social problem, they are still what I still be writing on. Malaria, tuberculosis, conflict, violence in Nigeria, gender-based violence. The problem that I started to research on about 30 years ago, it is still the same problem that I'm still writing about. Even in 2024-2025, the first title of that paper is Health Development in Nigeria. I abandoned that particular title when I got to a particular stage, and I was reflecting, what is really wrong with us? What is really wrong with you? The direct title will have been, what is really wrong with Nigeria and with Nigerians? But if I say that, many people will know that I'm talking about Nigeria. So I removed Nigeria, I put you there. Many people that came to that particular lecture, they were there expecting me to be talking about them. And before that time, 3 weeks to that time, when the flyer came out, people were interrogating, what is really wrong with you? What is really wrong? So many people came there expecting what I will say. And I succeeded in bringing people either online on ground to come and interrogate about the problem about Nigeria and the problem about Nigerians. And I said, I don't know. Nigeria doesn't know what is wrong with it. Our leaders don't know what is really wrong with Nigeria. If they know, if you know that you are planted a something somewhere and there is a pest that is destroying it, what you need to do is just to prevent the pest from coming. But Nigeria, we understand the problem, but we cannot solve the problem because they are so complex. They are so much. That's why we still have the problem of malaria, we still have the problem of violence, we still have the problem of corruption, we still have the problem of adulterated drug, we still have the problem of inability to fund it as well to fund it. That's why I interrogated with that question. What is really wrong with you? And what is you? You are a Nigerian, I'm a Nigerian, Tinubu is a Nigerian, Bao is a Nigerian, PS is a Nigerian. Every one of us, we are Nigerians. So when we are talking about Nigeria, we are talking about ourselves. So what is really wrong with ourselves that we cannot solve Nigerian problem? And I said, we don't know. Can you tell us? And I put it, sociological diagnosis without end. We are still researching. We are still studying. We are still looking for the solution. And that language itself, for people who understand medical doctors, what they will ask you if you are always visiting them with one problem or the other is that what is really wrong with you? But the bad aspect of it is that if you tell a medical doctor what is wrong with you, malaria ni, tuberculosis ni, the doctor will answer you, who told you? So diagnosis will start all over again. If they've not sent you to go and do test, they will send you to go and do test from one test to the other. You may think it's malaria, then I find out that it's typhoid. You may think it's typhoid, then I find out it's ulcer. You may think it's ulcer, then I find out that it's cancer. You may think it's cancer of the colon. They will say it's not cancer of the colon, it's cancer of the kidney. So it's analysis. We are still analyzing the problem of Nigeria. And I pray by the grace of God, one day we will get to that solution and the problem of Nigeria will be solved.
Yes, all right, before we leave that, the issue of the inaugural lecture, what are the key messages that you are trying to pass across to Nigerians and the university community?
One, before we got to the conclusion, there is a place there that I said, earth begins with you. Earth begins with you. If every one of us will maintain our earth, we eat well, we drink the right water, we go to the right place, we eat in the right manner, I will be healthy, you will be healthy, and Nigeria will be healthy. In fact, government will spend less money on medicine or medical doctors on drug because we will have prevented a lot of diseases and sicknesses, and we don't need to visit the hospital. So that is the first message. Health begins with the people. Do the right thing at the right time, eat the right food at the right time, drink the right water. Don't do anything in excess. If you want to drink in moderation. And we know the problem. We know the causes of malaria. We know the causes of cancer. We know the causes of typhoid. Let us run away from it. That is for individuals. For the university community also, let me say this. There is a place we are talking about, Japa syndrome. Our medical doctors are traveling abroad. Nurses are traveling abroad. Our health workers are traveling abroad. But do you know, as they are traveling abroad, Nigerian government has refused even to replace them in the hospital. Go to any average hospital today, the doctors are not there because they have traveled abroad. The first solution is that you cannot stop any of our doctors or nurses or pharmacists from traveling abroad. The best we can do is to produce more. So government needs to increase the quota of our university, even to admit more doctors, to admit more nurses, to admit more pharmacists, because people will go, but as they are going, as we produce more, then we'll be able to retain them even in our facilities, either at the private or public health. That is for the university. And also the health education also needs to be more qualitative. Nobody, no doctor, no nurse, no pharmacist have traveled abroad today, and the government of UK or America send them back because they cannot perform. All of them have been performing. In fact, we have scouts coming from Europe and America to Nigeria to recruit them because the education that they are giving, the practical that they are giving is very, very qualitative. If it is very qualitative, then government needs also even to take care of the doctors and the teachers teaching them. Doctors need to take care of the hospitals. Government needs to take care of the hospital to train them more and more, so that people abroad will be able to seek them, and government also need to replace them in our general hospitals, teaching hospitals, primary health care facilities. That is for the university and for the government. Let's look at their salaries. Their salaries and their condition of service is very, very poor. Government needs to do more. There was a time we have a minister of labor who was saying anybody that want to travel abroad would then should travel. That is appalling. They were giving 5,000 naira as hazard allowance about 5 years ago. 5,000 naira for a medical doctor trained in nothing less than 6 years in the university, and you are giving him 5,000 naira as hazard allowance, 60,000 naira even in a year. It is appalling. So government needs to do more, even to train and also to provide enough environment for them to stay in Nigeria. And if they want to travel abroad, then you recruit more, you train more. That is for government and for the healthcare facilities. Then we talk about corruption also. Government also needs also to remove corruption in the value chain of healthcare management in Nigeria, from the top to the down. It's not only the politicians, it's not only the managers, even the doctors, even the nurses, even the shoes, even the health assistants. We need to remove all this lack of transparency, lack of accountability, and pilfering of drug, pilfering of materials, pilfering of equipment, even in our hospitals and basic health centers. Those are the issues that were raised even in the lecture.
All right, and your presentation you made, you came up with some recommendations. Do you see government implementing some of these recommendations?
If government will not do some of the recommendations, then it will still be another sociological diagnosis without end. Number one, the first one there is that we have birth registration that is done by National Population Commission. My interrogation is, what is the business of National Population Commission in registering birth? People give birth in primary health care or secondary health care. Why not allow the hospitals and the basic health centers to register even the children? And National Population Commission will just go to those hospitals and extract the data. Simple. With that, you redirect attention to the hospitals. You redirect attention to basic health facilities, because as we speak now, Ekiti State, that is the fountain of knowledge, many of our pregnant women, they attend antenatal clinic. Most of them, they attend antenatal clinic in government or very good facilities. But when they want to deliver, they don't deliver. Less than 60% of our pregnant women deliver even in public or very good health facilities. But if they know that if you deliver in a wrong place, your baby will not be registered, and if you are not registered, your children will not be allowed to attend primary school or creche, then they will be forced to come and deliver even in government or very good health facilities. That is number one. As we have now, we have what we call the National Primary Health Care Basic Health Fund all over now, and it is constitutional money that they use even to run that particular national body. But what they do is that they only focus on one basic health center per ward. One basic health center per ward. Let's look at in a situation like for instance in Ishokan political ward, where they have 3 or 4 towns. 3 or 4 towns, even with 3 or 4 basic health facilities, and you are funding only one basic health facility. What happens to the rest? My recommendation is that since it is constitutional money, statutory money that they are using, even to fund that particular service, it should be for all hospitals. It should be for all basic health centers, even in Nigeria, because you are excluding facilities and infrastructure and support even to others. That's the second one. The third one also is that government in itself should ensure that primary health care centers, they are equipped with doctors and nurses to take care of chronic diseases. In Ekiti State now, if anybody is suffering from kidney, they are not likely to visit general hospitals. They are likely to visit the tertiary hospitals. Government should empower general hospitals and basic health centers to take care of chronic diseases, at least at the nascent stage or at the terminal stage, to provide enough drug, so that if anybody wants to test, if anybody wants to do diagnosis, you don't need to run far. Sometimes even I know in Ado-Ekiti, we have people who travel to Ibadan or Ife or to even Lagos to do kidney test to virtually maybe twice in a week, twice in a month, and it's very, very expensive. So the money is there. Government can devote enough resources to general hospital. In fact, I also recommended that we have primary health care development fund. I also recommend there should be national secondary health care development fund. The way they do even for primary health care, they should do the same for secondary health care. That means our general hospitals. Government should take it over. Federal government should take it over in collaboration with state government, so that they will have enough resources. They should be able to pay. Even if you go to Lagos, it is still the same salary that you are collecting in Ado that you go and collect in Lagos. In that wise, you don't need to japa. You don't need to japa from state government employment even to federal government employment, because it will be the same facilities. Just like NUC is the one overseeing all universities in Nigeria, that particular agency of government will now oversee all general hospitals in Nigeria, and they will provide the same quality health care. They will provide the same salary. They will provide the same condition of service for nurses and doctors and pharmacists even in Nigeria. That's another recommendation. Another recommendation is that government since 2001, they have not devoted enough money even to health care. It should be minimum of 15% of annual budget to health care, but no government has exceeded 8%. In fact, the present government only gave less than 6%. And the reason why the whole nation in Africa said 15% of the national budget, that if you have devoted 15% of national budget to healthcare will have enough resources. They'll be able to pay enough good salaries, provide enough equipment, take care of the nurses and the doctors, even train more doctors and nurses. But government have never since 2001. So it's an advocacy, it's a call, and it is an issue for government also to redeem itself from the bad image that they are not devoting enough resources. We are not only talking about federal government, even the state governors, they are not devoting enough resources even to healthcare. They are not devoting enough resources even to education. They are not devoting enough resources to water supply. They are not devoting enough resources to energy and electricity. So it's a clarion call. If you want to show that you love the people, you don't want to die, then fund them adequately. Another recommendation is that all over the world now, we talk about health finance. And the model all over the world is that you must implement health insurance. That even if I don't have money, somebody has paid, government has paid, or I have paid indirectly before I go to the health center, even for services. Health insurance. I know it's the Ekiti state government, they have the Ulerawa, they are doing better than other states, and they have other services for the pregnant women, for elderlies, for students, and for workers. But we can do better. We are doing better than other states, just as a model. What about those who are in a formal sector? If health insurance covers everybody, even if I don't have money, if salary is not paid, if people are not coming to me and my wife is pregnant, the service will be provided even at the nearby hospital, either general hospital or the primary health care level. And once this is done, we will be at par with America. We will be at par even with Europe, because if a resident of UK today, one of the facilities that you will enjoy once you are not an illegal migrant is health insurance. You go to nearby, once you are registered, you go to nearby facilities for health care, but you are paying for it too, but you don't pay from your pocket. We call it out of pocket expenses. You don't need to say me only 10,000 naira ni mo fi lọ sí hospital torí pé mo ní malaria. Your malaria treatment is already pre-paid. Somebody has paid, or government has paid, or you are paid even ahead. Whether you have money today, it doesn't matter. Whether your wife is pregnant and the doctor said we will do cesarean operation, you don't need to shout only kilomo 150,000 naira. No, the 150,000 naira is already pre-paid. Okay, abale. So everybody will not go to quacks. Everybody will not go to places where you ought not to go for treatment because you know somebody have paid for quality care service. So those are facilities. And now I have said within the next 10 years, government can do all these things. It doesn't take money. It takes planning. It takes knowledge. It takes compassion. It takes passion on our leaders to do what is needful. And I've not recommended anything that is new. I have only advanced what other people have been saying. If you want to achieve Earth Sustainable Development Goal by 2030, this is what we ought to do. There is sensitization. Let me give you, because we are in Ekiti State, our audience, I have said, many of our pregnant women, they visit antenatal clinic, but they refuse to go to public health service, either the basic health service, either the hospitals, and so they go to quacks. They go to Ile Agbebi, and when there is complication, it's either the woman will die, or the baby will die, or the two of them will die. But such will never happen in a public health facility. Such will never happen in government-owned health facilities. And I'm using this also because I said health begins with you, with me. That our women at home, that you are pregnant and you refuse to go to the nearby basic health facility for antenatal and for child delivery to take care of your baby, and you go and waste your time and you go and waste your money where you ought not to go, you will have yourself to blame, and God also will blame you, because government are provided even in all facilities, in our basic health centers and general hospitals, to take care of you. Then another issue that we are talking about, gender-based violence. We have enough information all around. We have, and a very good example is female genital mutilation. They said, káwọn èèyàn má dábẹ́ mọ́, wọ́n tẹ̀ tí wọ́n tún dábẹ́, òfin wà pé kọ́ máa ṣe, àwọn èèyàn tún ṣe ìjọba la fi ń ṣe ni àbí a fi ń ṣe ra wa. We are saying if you do this, you are injuring your female child, you are injuring her psychologically, emotionally, medically. There can be complications, but our women especially, because studies have shown that it is women that is cutting even their granddaughter, or even cutting even their daughter. People should stop all these negative practices. These are issues that were raised.
All right. In the recent past, we've seen scholars making recommendations of such. Why do you think government failed to implement all these recommendations?
The issue about academics is that if you look at the first page of that particular paper, I quoted a statement that a sociologist, that what he sought should not only be a theoretical sociologist, must be a practical sociology, working with the people. As I leave this studio today, I'm going to another function. I'm interacting with public servants, with health workers, with doctors, with politicians. I not only theorize in the university, I go outside there also to also speak about what I believe government should do, what I believe our community also should do, and that should be. It is not academic for academic's sake. It is academic to change the society, to change the community by working with them. And that is a lacuna in the university. That is what we call the gown-town relationship. Our academics, our colleagues should move beyond the gown, even to the town, to do what they are theorizing or teaching even in the universities.
Right. In your own view, has Nigeria fully embraced the input of medical sociologists in national and state level health program?
The answer is yes and no. Even in that lecture also, I mentioned names of medical sociologists or health sociologists in Nigeria. All of them, they have worked practically with the health practitioners, health researchers, with politicians, and with political leaders. And I'm one of them. I know by the grace of God in Ekiti State, I'm working with the government without pay. I'm working with Ministry of Health. I'm working with Ministry of Women's Affairs. I work with virtually all ministry related even to the community, to the people. And that is what ought to be in every state, even at the national level. I work with government, non-government agencies at national level, even at the zonal level in southwest Nigeria, all over. And that is what medical sociologists ought to be. And we are. I can mention names, but there's no point to mention names, because the problem is not in the classroom. The problem is with the people. If you don't go to the people and also educate them without speaking theory, without speaking grammar, They will understand what you are saying, what you are doing. It's not a classroom thing. I tell my students, if you go outside of EXU, nobody will ask you about the theory of Emidonkaim. Nobody will ask you about theory of Kant. Nobody will ask you about theory of encompassing. Nobody will bother you about Max Weber. What they will bother you is that, what can you deliver? Swallow your theory, but deliver what will change the life of the people. So the gown is useless without the town. Because whatever you do in the gown that doesn't reflect in the town, you are just doing theorizing. And I know medical sociologists, we are doing our best even towards that. All medical sociologists that I've known, who are my seniors, who are my fathers, they have what they are doing, even with the people at the community level, at the national level, at the state level also, even with medical practitioners, with everybody, international and local, to make sure that what we teach, it has implication or ramification to change or to produce human development.
All right, because of our time, let's talk about the way forward to the challenges facing the health sector. What are the way forward?
Number one, I know the budget for 2026 in Ekiti State. The process is about to start. I want to appeal to Nigeria, to Ekiti State government, to the line item for health budget should be specific, should be proactive, to take care of the basic needs of the people of Ekiti State, to make sure that the doctors and the nurses are adequately taken care of, even in the budget, to make sure that malaria control, tuberculosis control, HIV and AIDS control, chronic disease control in Ekiti State is adequately budgeted for, because charity must begin at home. I cannot be talking to them in Abuja without talking to Ekiti people. And I want to encourage also our nurses, our doctors at home also. Let us be passionate. Let us be proactive. Let us make sure that we can solve this problem. We can reduce the death burden. We can reduce malaria epidemics. We can reduce tuberculosis epidemics in Ekiti State. And make sure also, and we can also eliminate neonatal mortality. We can reduce drastically maternal mortality in Ekiti State, and make Ekiti State a fountain of knowledge, a fountain of health that we are known for.
Yes, sir. Let's talk about the budgetary allocation for the health sector. Are you satisfied with the budgetary allocation for the health sector, both at the state and the federal level? Absolutely,
I am not satisfied. We have said in the last 2025 budget, the federal government budgeted 5.8%, but it has to be 15%. Ekiti State budgeted a range like that. And my concern is that even if you budget, what did you budget for? You budget for salaries. Won't you pay salaries before? You budget for a payment of arrears of salaries, arrears of a leave bonus. Won't you pay the salaries of doctors and nurses before? The most critical need is, how do we reduce the death burden at the national level, at the state level? How do we increase the training of doctors and nurses? How do we retrain them? How do we make sure that their condition of service is improved? And secondly, what is the budget about malaria control? What is the budget about tuberculosis control? What is the budget to take care of chronic diseases, especially kidney, cancer, heart problem, diabetes? All those issues, it must be specifically stated. How do we encourage our nurses to do more in terms of improving immunization program at the state level, at the national level? So let's increase the budget. Let's make it line out. So if anybody will see this government is committed X number of millions of naira to malaria, to kidney control, to cancer, to heart problem, to diabetes, to chronic diseases, to tuberculosis, especially the fact that now we know that the international funding for healthcare has reduced drastically. Trump has removed every support is given to Africa in terms of healthcare delivery. So who now take care of the burden? It's not only the federal government, but the state government must do the same, the local government must do the same. So I'm encouraging the state governments, not the state government alone, and the federal government, let us go towards that 15% allocation, so that our health workers, so that even the people also, we will see the impact.
All right, Professor Oluwadare, before we wrap it up on the program this morning, what's your closing remarks to people?
My closing remark is that help begins with you. Help begins with me. Government, people are saying ebi ń power. I was thinking about it. Ebi wo ló ń power. Ẹ jẹ́ ká jẹun tó dá sẹ́nu ara wa o. Ìlera ó bẹ̀rẹ̀ pẹ̀lú ìwọ àti èmi. Ó bẹ̀rẹ̀ pẹ̀lú pé ká jẹ oúnjẹ tó dára, ká mu omi tó dára, ká sùn lásìkò, ká wẹ̀ lásìkò, ká ṣe nǹkan tó dára lẹ́dọ̀. Prevention is better than cure, and cure is more expensive than prevention. So let us prevent all these diseases. That's my closing remark.
All right, Professor Oluwadare, thanks for joining us on the program this morning.
Thank you, sir.
Thank
you for the opportunity.
Nigeria continues after this break. Thanks for watching. Don't go away.
Nigeria, from EKTV, in the heartbeat of the Southwest. We break your day on EKTV Daybreak Nigeria with inclusive information, news without prejudice, well-articulated reportage, in-depth news analysis, newspaper highlights, business news, sports. Watch EKTV Daybreak Nigeria from 8 to 10 in the morning